First of all, thank you very much to the organizers of this workshop for extending the invitation for me to come and speak. I'm going to briefly, very briefly talk about my current research activities here in London, and also my teaching activities around Europe. And then, so very briefly, and then focus on the small things that I'm doing and that I've been doing to try to build strengthen capacity in biostatistics in Sub-Saharan Africa. As Christopher has mentioned, I'm an assistant professor at the London School of Hygiene and Tropical Medicine. I'm an alumnus of the Master of Statistics at Hasselt. I also did my PhD in statistics at University of Hasselt and my postdoc at the same university. In terms of my current research, I'm based within the Inequalities in Cancer Outcomes Network, which is a research group at the London School of Hygiene and Tropical Medicine. And what we do is to study inequalities in cancer care and cancer outcomes in England. In terms of how we do that, we use data from different sources. We use what is called population-based cancer registry data, but also what we call primary care data and secondary care data. The evidence that we generate from what we do is crucial because then policymakers can use this to formulate targeted interventions to ensure that improvements in cancer care are experienced by all the people in England. So to ensure that there are no inequalities in cancer care. For the statisticians, in terms of what are the statistical methods that we use, we use first of all, for instance, spatial time to event analysis methods called excess hazard models. They are a complex analysis approach for analyzing population-based time to event data, because there are some complexities of the data setting that make it that invalidate classical survival analysis methods. We also have to deal with missing data in important prognostic variables such as stage at diagnosis. And in particular, we do find missing data problems in which it's quite tricky, quite complicated to assure what we call compatibility between the imputation model and the substantive model, or what we call the analysis model. And therefore, some of the methods we use include what we call substantive model compatible multiple imputation techniques. Apart from that, I'm currently working on a project where I'm using what we call high dimensional joint models for analyzing multiple longitudinal outcomes when these multiple longitudinal outcomes are quite many, meaning that you do get, it becomes quite complex in terms of implementing joint models. So that's a very brief overview of what I do in terms of research. For those who are interested, you can check our website. Just check Inequalities in Cancer Outcomes Network, London School of Hygiene and Tropical Medicine. Or if you'd like to discuss further, you can drop me an email via the email address that I've provided here. At the school, we have an MSc in Medical Statistics, a one-year MSc in Medical Statistics, and I teach what is called Advanced Statistical Modelling towards the end of the MSc. Apart from teaching at the school, there is a summer school called the Corsican Summer School on Modern Methods in Biostatistics and Epidemiology, which is organized every 2 years in Corsica, France. So in 2017, 2019, unfortunately this year I don't think it's going to happen because of the situation, but I've been an invited lecturer for this summer school to talk about how to handle missing data in cancer epidemiology. Now moving into the various small steps that I have taken and I continue to take to ensure that as a recipient of the ICP scholarship, I try to magnify its impact. One of the things, sorry about that. Can you see my screen?
Yes.
Okay, sorry. One of the things that I've done is that during my postdoc at the University of Hasselt, together with colleagues at the university, we worked jointly with colleagues at the University of Nairobi School of Mathematics and other colleagues at the Jomo Kenyatta University of Agriculture and Technology in Kenya. And we developed a proposal for capacity building in biostatistics, which was submitted to the Flemish Interuniversity Council. In the context of that project, I was a named collaborator, and we were successful in that grant application. In the context of that project, there were a number of things that were planned. One of them was to train a number of PhD students in biostatistics. So a number of students are from Kenya. And in terms of my involvement, I have been co-supervising one of the students who is jointly registered at University of Hasselt and the Jomo Kenyatta University of Agriculture and Technology. Apart from that, in 2018, I taught a 1-week short course on longitudinal joint modeling at the University of Nairobi School of Mathematics. We had around 100 researchers, lecturers, PhD students attending the short course. The feedback was, people are very enthusiastic about the short course, the content of the short course, the delivery of the short course, and arising from that short course, over time I've had interactions with different researchers who are quite keen, so researchers from Kenya who are quite keen on using joint models, doing research using these types of techniques. In addition to that, in 2019, I submitted an application to the International Society for Clinical Biostatistics for some funding to organize a short course on the spatial survival analysis techniques. I did mention that when analyzing population-based time-to-event data, we don't use the classical time-to-event analysis methods. So I applied for funding to organize a short course on these spatial analysis techniques, to organize this at the University of Nairobi School of Mathematics. And I got some part funding, which helped to organize this short course. So 2 lecturers from the London School of Hygiene and Tropical Medicine went down to the University of Nairobi and taught the short course, where we around 70 people attended, and the response was again very encouraging. People were really happy with the content and the delivery, and many of them were quite keen on how these methods, for instance, can be used perhaps in their own research. In addition to that, last year, because I've been maintaining quite some close contact with the University of Nairobi School of Mathematics, colleagues from that school. they were working on a grant proposal jointly with the University of Nairobi Institute of Tropical and Infectious Diseases and other departments within the university and other universities as well. They were developing a proposal on COVID-19, which they were planning to submit to the National Research Fund in Kenya. And so they reached out to us. It's people that I've already worked with. I continue maintaining a collaborative environment with them. And from the London School side, we contributed to that proposal in terms of our expertise in statistical and mathematical modeling. And I'm happy to say that the proposal has been shortlisted by the National Research Fund, and we are hoping that it's going to be successful in the next few stages, and then the study can kick off in Kenya. Apart from that, there are a number of other small things that I continue to do. For instance, I give regular career talks at the University of Nairobi School of Mathematics. I do go there, or for instance, last year, I did it online via Zoom. I talked to the students who are doing their BSc in mathematics, BSc in statistics, about what biostatistics is all about, biostatistics and medical statistics. And whereas it's just a small thing, it has had quite a massive impact, because I do tend to see students reaching out, saying that they're happy to learn about biostatistics. Some of them go on to apply for scholarships. And for instance, already 2 of the students that have attended some of my talks, I think in the previous, two or 3 years, have been successful in getting scholarships to study medical statistics here in the UK. And therefore, that has also had some impact, whereas it's just a small thing. I'm also quite committed to collaborate whenever I can, as time allows. And recently, there's a student from the University of Nairobi School of Mathematics. They have got a master's program in biometry, and a student was doing his project, and he was interested in using longitudinal joint models for longitudinal time to event data. He reached out to me. I was happy to collaborate with the supervisors. When I had a chat with the student, I noted that he was quite keen on this topic, whereas he's quite advanced. He sounded quite an enthusiastic and hardworking student. I was able to supervise him, and he recently finished his MSc project, did some very nice work. In addition to this, there is an ongoing, perhaps it has concluded, I'm not very sure, but there is a capacity building initiative called the Sub-Saharan Africa Consortium for Advanced Biostatistics Training. And a couple of years ago, I was invited to be involved in its activities, and I was happy to do that. In the context of that particular capacity building initiative, one of the things that I've done is to supervise a PhD student who is doing a PhD in biostatistics at the University of Nairobi School of Mathematics. By the way, the student is also an alumnus of the University of Hasselt Master of Statistics program. The student is working on missing data problems, in particular sensitivity analysis when you have missing covariates, and in particular when the data are clustered, so hierarchical data. But also working on high dimensional joint modeling problems. And the application area that she's focusing on is inpatient pediatric pneumonia quality of care studies in Kenya. The student has done tremendously well. She already has peer-reviewed publications in journals such as Statistical Methods in Medical Research and Journal of Applied Statistics. For the statisticians, you do know that these are really nice journals to publish in. So she has done tremendously well. And this demonstrates that the ICP alumni continue to do exceptionally well out there. She has finished her thesis, and she's awaiting her defense. Finally, within the same initiative, in the 2017-18 and 2018-2019 academic years, I was invited to teach the longitudinal data analysis module for the MSc in Biostatistics at Stellenbosch University in Cape Town. I was happy to do that. I, developed the material, and then I would fly down to Cape Town twice a year, so in February and April, for intensive one-week blocks, so teaching the students face-to-face. And then when I come back to London, I would have virtual meetings with them to touch base, see how things are going. And in both years, the students were really enthusiastic about the module. They did very well in the assignments, and very many of them were inspired to consider longitudinal data analysis, joint modeling as well, because there was a topic on joint modeling as well in the module, to consider these as work that they could do further post-MSc. The students were from a variety of countries, some from South Africa, others from Zimbabwe, others from Namibia, and therefore that initiative built capacity quite in a number of countries. In terms of, for those who would like to talk more, get in touch, you can find my email address, read a little bit more about the work that I do on our university website, which I've provided there. But also you could reach out on LinkedIn. My LinkedIn name is Njeru Njagi, PhD, and then we can talk more. LinkedIn, perhaps I should have mentioned this as well. Whereas it's just a social media tool, I find that you are also able to build capacity by interacting there as well, because sometimes when I'm going to give a talk, or sometimes when I have a new publication, then I post it on LinkedIn. Then sometimes I do tend to see students, for instance, from Kenya, who are doing their BScs, reaching out, telling me, I would be interested to know more about what biostatistics is all about. And then whenever I have time, I respond, we chat a little bit. And sometimes the students are inspired to go on and apply for MSc programs. And sometimes, even if, say, a student is not able to get a scholarship, sometimes I remember talking to one of the students who applied for a scholarship. She wasn't able to get a scholarship. But then I mentioned about the fact that the University of Hasselt Master of Statistics has also started a distance learning option, a blended learning option, which is also quite affordable. And I was surprised that she took that quite seriously and enrolled for that program. And that's also, I think, a way of continuing to build capacity. So to the students who are doing their programs at the moment through the ICP program, it's just to encourage you that there are many ways in which you can continue to contribute to capacity building, to magnify the impact of the ICP program, even by raising awareness about biostatistics using social media. So there are many ways in which you can continue contributing. I'm going to stop there and once again thank the organizers for the invitation to this workshop.